here at the COMy meeting to discuss the impact of the new response criteria manuscript, which has been authored by Shashi Kumar with a group of experts. And this will change bring clarity in response definition. There are several new elements. Number one, complete MRD negativity includes serological MRD negativity, bone marrow MRD negativity, imaging MRD negativity, and so it's total. It's a composite MRD negativity finding, which qualifies a patient as complete MRD negative. So that's very important. So he's very careful in distinguishing different response types when it comes to imaging. When you use MRI for imaging, there are also he distinguish different types like partial response, complete response, progressive disease, and in a very precise form. And the same applies to PET-CT. So again, you have these different response criteria or classes, and this gives guidance to clinicians, but also importantly for people who run clinical trials, because we need to have uniform response criteria in order to be able to compare one study with the other. In addition, of course, his recommendation is to do, when patients are in clinical studies, to do these exams without the imaging exams, but serological exams after every cycle. This will be difficult in clinical practice because now we have several regimens where you don't, where a cycle may last 8 weeks, 12 weeks when you look at, when you think about belamaf. So I think this needs, to implement this needs clinical reasoning. And what is also important is urine is important. So you have to analyze, because people want to get rid of urine, 24-hour urine collection. But if you want to follow the recommendations, you need to have a 24-hour urine sample, and you need to test the sample for residual protein. So you need to do an immunofixation, and you have probably sometimes to concentrate the urine. So that is essential. But if the baseline urine is negative, then in clinical practice you don't need to care for further up studies regarding the urine. So I think it will make life clear, response evaluation clearer, but it's not going to be much simpler, because you have to acknowledge or to include all the different parameters in order to get a whole picture of how well patients respond.